Hello, hello, my lovely nurses. How are you all doing? This is your MedSurg Decoded RN, and I'm back again. We are about to learn something, okay? So grab yourself a cup of tea and get your pen and paper, and let's learn. You know how we do it. We just go straight to the point, okay? Today, I'm going to start this way. I'm going to start with a riddle. So listen carefully. Riddle, riddle. I am first to arrive when there is bleeding. I don't build the clots alone, but without me, nothing begins. Who am I? Click, 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 click. Do you know what we're talking about? If you guess platelet, kudos, you got it. Good job. If you didn't guess platelet, that's fine. That's why we're here. We're going to learn, okay? So today we are going to talk about platelets. Now, my lovely nurses, come here, come closer. Let me ask you something. How many times have you given your patient heparin or enoxaparin without checking their platelet level? Come here, come here. Tell me, how many times? I've done it before, but am I going to repeat it again? No. So let's learn. So today we're going to talk about platelet. But before we talk about platelet, we can't talk about platelet without understanding clotting factors. We need to understand clotting factors. So what are clotting factors? They are basically proteins in the body that helps prevent excessive bleeding. Okay? So clottings or clotting factors are made or they are being produced by the liver. The liver is so important, guys. It is so important. It is a very huge vital organ. So if clotting factors are being produced by the liver and you have a patient with liver problem, a liver disease, what do you think is going to happen? The patient runs a high risk of getting into excessive bleeding, right? So in future, if you have a patient who has liver problem, you should watch out or monitor the patient closely for bleeding because they don't have these clotting factors. If you have a problem with your liver, obviously your clotting factors is being impeded. Okay, so keep that in mind. Now let's go to our main focus, platelet. What are platelets? Platelets are blood products that rush to an injury site to help prevent excessive bleeding. So you might think, oh, platelet and clot factors are the same. No. Platelet has to act first before clotting factors follow. Okay? So when there is an injury, platelet run to the site to help and try stop the bleeding. then our question will be, what does the clotting factor do then? The clotting factor also comes and acts as a fibrin or acts as a net, okay, and binds the platelet together to form a strong hold. So let's look at it in this way. Platelets will be just like let's say a band-aid, right? Just a little band-aid on your skin. But in order for the band-aid to stay strong, we have something like Gorilla Glue. Okay, coming to glue itself to the band-aid. Will it be easy for the band-aid to come off? No. So that is one example. Let's also look at, let's compare a bricks, brick, what we use for building, and cement. Imagine you have a hole in your house. You have to first layer your bricks or your blocks. If you just layer them there and you leave it, did you do anything? No. So just the layering is good. It will help a little bit. It will bring privacy a bit. But if somebody bumps it little, it's going to fall. But that is where your clotting factor comes in. It comes and fills the gaps in your bricks and makes your building strong. Okay, so a patient with low platelets, which is termed as thrombocytopenia. If your patient has low platelet, what do you think will happen if the patient should get an injury? Because we already know that platelets helps prevent excessive bleeding. So if you have less platelet, you are going to bleed a lot if there's an injury. Okay? What if you have high platelet, also known as thrombocytosis? If you have high platelet, you also run the risk of getting blood clots. Because when there's a lot of platelet, clot factors come into play also. Okay? So keynote, if you have a patient who has high platelets, you should be asking yourself, is this patient on a blood thinner? Because the blood thinner can help break the clots, prevent any clot formation. So you should question that. If your patient is not on any form of blood thinner, like your heparin, your enox, then you can bring it to your doctor's attention. What if your patient has a low platelets? What are some of the things you have to watch out for? Patients with low platelets bleed easily. So if you go, let's say you go to the ward and you do your assessment and you notice a lot of bruising on some patients, right? They brush their teeth and the little thing, they are just bleeding from their gum and all that. You should be thinking, this patient might be having low platelet. And also ask yourself, if the platelet is low, is this patient on any blood thinner even? Because if the patient is on a blood thinner, it has to stop. Okay, you need to question that. Now, what are the values for platelets? We usually want a range of 150,000 microliters to 450,000 microliters. Okay? So, guys, the next time you go and give that heparin to the patient, check their platelet first, please. Check it to make sure it is not contraindicated. And check it to make sure it is not going to cause your patient to bleed a lot. Okay? That is it for today. Have a lovely day. Thank you for watching. If you want to know more, please subscribe to my YouTube channel, MedSed Decoded RN, for more information.